a speech pathologist and a mom, and I realized that I have a problem. When I was pregnant with my first son, my pregnancy gave me severe escalating back aches that completely subsided with delivery. The third time it was exactly the same, but right after delivery my pains did not go down. The pain was shooting to my legs, it was numbing my toes. It was so severe that I could not sleep at night, I could not go to work, and I was home for good 3-4 weeks until my friend literally picked me up and she pushed me to go for an MRI.
I was expecting to find the perfectly normal scan because the lady's 35 years old, but lo and behold, I saw something that worried me a great deal. And so, in fact, I saw the film over a weekend and asked her to come in first thing on Monday morning. So what we're looking at is an MRI prior to surgery. And if you take a look, the white fluid that normally bathes and cushions and protects the spinal cord and the nerves is blocked by this large mass that's sitting right in the center of the spinal canal where the nerves are. And so this is taking up virtually the entire space and squeezing the nerves off to the side.
So it was shocking, it was nerve-wracking, I have no words to describe the emotions that I went through at that point. But he was very comforting on the phone.
Ms. Katz had an extremely rare intradural spinal tumor. It's right at the base of the spinal cord with all the nerves that go down to the legs. Invariably, this would have led to paralysis of both legs. In a 35-year-old woman, this would be a devastating problem because it would result her, to live the rest of her life in a wheelchair and losing bowel and bladder function. And that's obviously devastating at any age, but especially in a young mom.
He suspected that it was 80% benign, 20% might have been malignant, but we won't know until we biopsy it. So it was very, very difficult until we finally got all the results.
The typical course of treatment in vast majority of these cases is surgical debulking or excisions. And so we remove as much as we feel can be safely removed. The surgery took approximately 5.5 hours. So this is obviously what we just saw before surgery, and this is several weeks after surgery. And what you see is the spinal cord now coming down, and now you see the normal nerve roots and the spinal fluid space being completely reestablished, not blocked by the tumor.
The pain was gone immediately. There was no numbness, there was no neurological pain. After my surgery, it took me a month and a half to fully recover and go back to work full-time.
The fact that it was benign and the fact that we were able to remove the entire tumor without any neurological consequences is extremely rewarding, especially for someone with a life expectancy of at least another half a century who's got small children, and there's no greater feeling than that.
Dr. Zonenshayn and his crew, the support, the comfort, the care that they provide you with is really unbelievable.